हेलो दोस्तों, आप सबको मेरा प्रणाम। एम ऑडिबल एंड विजिबल? यस गाइस। हाय, हेलो एवरीवन। एम ऑडिबल एंड विजिबल? से हाय टू आवर फ्रेंड, a new friend. यस, मैंने कहा था प्रणाम हृदय, श्रीनिवास। यस, ओके। So today's topic is basically identification. So as you know, identification is very important in criminal cases, especially in case of skeleton. So you need to identify whether male or female, what is the probable age of the skeleton, height of the skeleton or height of the person, sometime race of the person. So there are four important components of skeletal remains. One is age, the second one is the gender, the third one is the stature, the fourth one is the race. So we're talking about identification and also forensic psychiatry. Okay. So before starting the topic, so I have a question for you. Here, identical twins, a bad boy and a good boy. So both are identical twins. So this is one very famous movie in Tamil, that is Time 24 movie. So my question is, how to differentiate between a bad boy and a good boy, or bad person and a good person, who are basically identical twins? Yes, yes guys. Mohammad Ansari, Ruday. Can anyone answer? Bad boy and a good boy. Is it DNA fingerprint or fingerprint? So only two options. DNA fingerprint. The basis of DNA fingerprint is VNTR, variable number tandem repeats. And the second one is the fingerprint. That is loop, hole, the arch, composite, the lockout principle. So what is the best answer? Okay, so very good. So in case of identical twins, the best way to differentiate, the best way of absolute identification is your fingerprint. It is not DNA fingerprint. DNA fingerprint is same in identical twin, but fingerprint is not same in identical twins. It is asked in your Viva and it can be asked in your INICET, FMG exam and any entrance exam basically. So the answer is fingerprint. Okay. So with this now let's start. So the most important questions from identification. The first important question, very commonly asked in the exam, define dactylography, or what is dactylography? What are the types of dactylography? What are the types? Alterations and medico-legal importance. As you know, medico-legal importance, it is used in civil cases, it is used in criminal cases. Criminal cases like rape, murder, civil cases like disputed paternity, disputed matter, so many cases basically, right? Yeah. So let's see one by one. So what is dactylography? See, dactylography is also known as Galton system. Okay, Galton system, because it is improved by Henry Galton. It is also known as fingerprint because it is formed by epidermal ridges. So in epidermis of the every person, there are some ridges are there. These ridges, they form characteristic pattern. So that is known as fingerprint. It is also known as dermatoglyphics because it is formed by epidermal ridges basically. That's why. So dactylography, nothing but fingerprint, also known as dermatoglyphic or Galton system. It is one of the commonest method of identification that is used. It is used in many applications, in your Aadhaar card, mobile applications, bank applications. So many applications, so they include fingerprint nowadays, even your Aadhaar card as well, passport as well. So complete formation occurs around 24 weeks of intrauterine life. So it is formed during around 6 to 7 months of intrauterine life. Can anyone tell me what is the center of ossification that appear at 7 months? 7 months. One very important MCQ commonly asked in university exam. What is the center of ossification that appears at 7 months? 9 months, as you know, lower end of femur. 7 months. Yes, guys? Yes, so it is basically Manjunatha, very good. It is talus. So the fingerprint, they are formed somewhere around 6 to 7 months. So at 7 months, the talus that appears. At 9 months, lower end of femur that appears. So upper end of tibia that appears at 10 months. All these are important MCQs. Then proof of identity in comparison, around 12 points. So there are many points. So when they do compare between two fingerprint, so they compare so many points. So minimum comparison, that is basically 12 points. So that should be 12 points. This is taken from Case and Reddy according to Locard basically. Fingerprint, it was first discovered in India by Sir Francis William Herschel and Francis Galton. Francis Galton. So remember the name, very commonly asked university question. William Herschel and Francis Galton, somewhere around 18 to 92. Around 150 years back. So it is discovered. It further improved by Henry. That's why it is also known as Henry Galton system. Henry Galton system. The first bureau was started in Kolkata, that is in West Bengal. Okay. Now let's see what are the types of fingerprint. So what are the types of fingerprint? So there are basically 4 types, as you know. The most common type is loop. Loop around 60 to 70%. So %60 to 70%. So it can be radial loop or it can be ulnar loop. The second type is Whorl, around 20 to 30%. Third type, arch. And the last type is composite, around 1 to 2%. Again, MCQ, least common fingerprint, composite. Most common fingerprint, that is loop. And one more important concept here is the core and delta. A very important concept, the core and delta. So what is core and what is delta? Can anyone tell me? What is core and what is delta in fingerprint? Priyanka? See, the core means C for core, C for curving ridge. Okay, it's a curving ridge. Curving ridge. Delta means 3-directional meeting point. It's a meeting point. Very commonly asked. Delta means meeting point. Like a coffee point. Delta is a coffee point. So curving point basically known as core. In case of loop, there will be one core, one delta. So लूप में आपको एक कोर मिलेगा, एक डेल्टा मिलेगा, ठीक है? In Whorl you will see two delta. In arch, no core, no delta. No core, no delta. So very important MCQ. Okay. Sanjana location others. Very important. Okay. Now, one more very important question asked in the exam. What are the conditions in which there is a permanent loss of fingerprint? Permanent loss of fingerprint. Can anyone mention what are the conditions in which there is a permanent loss of fingerprint? Permanent loss. So the permanent loss occurs in 3 conditions, commonly asked 3 marks question. So here 3 conditions. One is radiation injury. When hands are exposed to radiation injury, there can be permanent loss of fingerprint. The second one, leprosy. And the third one, electric injury. So electric injury. Some drugs like capecitabine also. So what are 3 causes? Radiation injury, Hansen disease, that is leprosy, electric injury, that is because of the electric burn. We call it a joule burn. So burn injury, there can be loss of fingerprint, but that can regrow. So there can be partial loss, not the complete loss. Okay. So very, very important MCQ. Now, one more very commonly asked question is, okay, capecitabine is asked, that's fine. So I'll repeat again. So whenever 5 marks question asked, you need to define fingerprint. That is fingerprint known as dactylography, Galton system, fingerprint system, dermatoglyphics. They are formed around 7 months or 6 months, and the talus that appears at the same time. The proof of identity, at least 12 points as per Locard. William Herschel, Francis Galton and Henry, and first bureau was in Kolkata. There are 4 types of fingerprint: loop, oval, arch and composite. The core means curving ridge, delta means 3-directional meeting point. 1 core, 1 delta, that is loop, 2 delta, that is Whorl, and no core, no delta, that is arch. Composite means that is the least common one. Is it clear, guys? The permanent loss of fingerprint seen in 3 conditions. One is radiation injury, leprosy and electric injury. Is it clear? Priyanka and others? Okay. Now you need to identify some important personalities. He is father of DNA fingerprint. Okay. DNA fingerprint. He is father of fingerprint. Can I identify these 2 personalities? Yeah. Okay. Menaka Datta? Yes. Smarane, at the end, you can ask me some doubts at the end. So, time being, we will continue. At the end, you can ask any doubt. So, I'll give you around 5 to 10 minutes. आपको चिंता मत लेना, चिंता नहीं करना. ठीक है? DNA fingerprint. So, this is first explained by Alec Jeffrey. As you know, DNA fingerprint principle is VNTR. Variable number tandem repeats. MCQ. What is the principle of DNA fingerprint? VNTR. Variable number tandem repeat. It is not constant number of tandem repeats. Variable number of tandem repeats. So all of you write in the chat box. Alec Jeffrey is equal to VNTR. Write this in chat box. Keep writing. Neha Reddy, Manjunatha Datta, Muhammad Ansari. So DNA fingerprint is one of the absolute method of identification. Even fingerprint also. In identical twins, we use fingerprint. So very important MCQ. Yes. Good. Priyanka, great. Manjunatha Datta, Ruday, Srinivas. Yes. Okay. Smaranya Hatti, keep writing. Yes, good. That's great. Now, I have 3 images here. 1, 2, 3. You need to identify what are these fingerprints. So, this is curving ridge, C, and somewhere here delta. So, one core, one delta is there. The starting point and exit point, entry exit point on the same side. So, what is this? So, this is basically loop. Here, what you can see here, central circle. So, whenever you see central circle, it is basically pole. And this is basically arch. Arch. Okay. So, commonly asked in exam. Then one more very important table from Case and Reddy. Mutilation of fingerprint. So there are some conditions. They are basically acquired condition. So there can be mutilation. So what are they? So pattern is retained, but change in the distance between the ridges. So the pattern is retained, but change in the distance between the ridges. So that is seen in case of acromegaly. So as you know, acromegaly is because of increased secretion of growth hormone after puberty. Then second one, rickets, because of the calcium deficiency in the children. So in both the conditions where pattern is retained, but distance between the two ridges is changed. Then moderate epidermal ridge atrophy. So it occurs in celiac disease. Okay, celiac disease. So a condition of hypersensitivity. Then incomplete ridge atrophy, dermatitis. In any condition of dermatitis, there can be ridge atrophy, but incomplete it is, not the complete. Permanent loss, as I said, radiation, leprosy, electric injury, capacitapine. Ridge alteration that occurs in case of scleroderma, especially in case of systemic scleroderma. So as you know, scleroderma can be of 2 types, localized and systemic. So in both the condition, there can be ridge alteration. Okay. Now, one more important point. What are the conditions in which fingerprints are absent. So there are some conditions, there are some genetic conditions in which fingerprints are absent. So what are they? Wade syndrome, Ginser-Coley-Ingman syndrome, Nagelli syndrome, adermoglypia. So all these are conditions where fingerprints are absent. You can see here, you can see the fingers here. So there are no epidermal ridges, there are no fingerprints. So this can be very important Viva question. If you mention these points, you will get at least 4 out of 5. 4 out of 5. Yes, Srinivas, Neha, Menaka Datta, Ruday, Smaranya Hatti. If you mention all these points, definition, types, diagram, that is the mutilation of fingerprint and genetic condition. So what is your probable expectation out of 5? Yes. Okay, Srinivas, good. Also need to mention about poroscopy. Yes. So poroscopy is first invented by Locard. It is very useful in scattered or partial fingerprint. Partial fingerprint. It is the study of pores, basically number of pores, distance between the pores, shape of the pore. So that is basically known as poroscopy. It is very useful in partial fingerprint at the crime scene. 4 mark. Yes, Menaka, that's great. 4, around 4. So this completes your 1 question. Now the next question, the next important question. Can anyone guess? So what you can see here, this is the lip print, and this is basically found in the crime scene, basically cigarette pieces. Is it possible to identify the accused by using cigarette butt? Definitely. While by using DNA fingerprint, if any epithelial cell, saliva, epithelial cells are there, you can identify. Also, at the same time, you can use one more technique. What is that technique? Yes, good. So many answered. So this is known as Cheiloscopy, lip print. Cheiloscopy. Usually 3 marks question. 3 marks question. Yeah. Yes, Cheiloscopy, 3 marks question. So there are different types of lip print. Basically there are A, B, C, D, E, F. So there are basically 5 types. So that is type 1. What is type 1? So type 1 means clear-cut vertical grooves. So like this, clear-cut vertical grooves that run across the entire lip. You can see here. You can notice here. The grooves are there. They crosses entire lip. That is known as type A or type 1 basically. So type 1 prime basically vertical but do not cover entire lip. Type 2 branched grooves. You can see here branched grooves. Type 3 intersected grooves. You can see here intersected. Type 4 reticular grooves. You can see here reticular grooves. Undetermined, basically that is type F. Okay. So this is known as Suzuki classification. So this can be 5 marks question. So all of you write in the chat box. Cheiloscopy is equal to Suzuki. Very famous brand Suzuki. I know Maruti Suzuki and all. Just write Suzuki classification. That is the classification of lip print. So there are basically around 5 types are there. The most common one is type 1 and type 1 prime. Yeah, good. Now you need to identify what type of what type of lip print is this. You can see here this one. It is going like this. Okay. It's going like this. So what is this type? Come on, guys. Identify. Vertical. So lines are vertical. I think you can make out. So it's branching also, but it is vertical, but not covering entire lip. So what is this basically? Is it type 1, type 2, 3, 4 or 5? So very good. So the many answered. Yes, Chandan. Chandan, MedNerd. Okay, so this is type 2. So is it clear, guys? Cheiloscopy? Any doubt? Yeah, type 1 prime basically. Yeah, it is type 1 prime. So it is not type 2, type 1 prime. Mohammed Ansari, yes. It is basically type 1 prime as well as type 2 as well as here there type 2 also. Next important question, commonly asked in the exam, Gustafson method. Okay, Gustafson method of age estimation by using teeth. So very commonly asked. So what is Gustafson method? Usually a 5 marks question. It's a method of age estimation. Yeah. So it's a method of age estimation. Usually after the age of 25 years. And this method is used in only dead persons, not in the living person. Okay, it is used in dead bodies. Dead bodies. The most common teeth used is anterior teeth. Anterior teeth. Again, it's very important Viva question. The most common teeth used are either incisor or canine, or it is premolars, not the molars. The third molar is least preferred. Okay, then it has 6 components. And each component has a grading, +1, +2, +3 like that. So the Gustafson method is a method of age estimation by using 6 components. So what are the 6 components? So the very old mnemonic since many years, since decade, APSRTC. APSRTC. AP means Andhra Pradesh, right? Andhra Pradesh, right? So Gustafson method. A for attrition. The attrition means wear and tear. So all of you write in the chat box, Gustafson is equal to APSRTC, old mnemonic, but very interesting mnemonic. Okay, keep writing. Keep writing, guys. So few points here there. Attrition means wear and tear. So as age advances, there can be wear and tear. Parodontosis, that is basically loosening of the teeth. One word. Secondary dentin, calcium deposition in the root. Secondary dentin. Dentin means calcium. The deposition of calcium in the root cavity, that is known as secondary dentin. Root resorption because of the osteoclast. Then transparency or translucency. Then lastly, cementum apposition. Cementum apposition means that is incremental lines like this. So you will see incremental lines under the microscope when you visualize the dentin tissue basically. Okay. APSRTC. So good. Now my question is, which is the best criteria? Which is the second best criteria? Second best criteria. Very commonly asked MCQ, very commonly asked university exam. The best criteria is transparency of root. Second best criteria, that is secondary dentin. So transparency, that is the best criteria. Second best, secondary dentin. Okay. So secondary dentin means deposition of calcium in the root cavity. For example, this is a root cavity. So what happens as age advances? So there will be deposition of calcium. Okay. APSRTC is the mnemonic. So A for attrition, P for parodontosis, S for secondary dentin, root resorption, transparency of root, C for cementum apposition. The best criteria, transparency. Second best criteria, secondary dentin. Is it clear, guys? Is it clear? Cementum apposition basically, when you see the teeth, when you see the cross section of the tooth under the microscope, you will see incremental lines. Okay, like this. You will see like this. So this is cementum apposition, basically because of the cement that accumulates. Okay, so now again in exam you need to write like this, especially in university exam to get distinction mark. So attrition, A0 no attrition, A1 limited attrition, A2 limited to dentin level, A3 up to pulp cavity. So this is the grading of attrition. This is the grading of periodontal disease and secondary dentin. So like this you need to write the grading of the each parameter to get distinction mark. Okay. So as well as other criteria, root transparency, cementum apposition and root resorption. And finally, how to calculate? So the calculation done with the help of this formula, that is age is equal to 11.43. Again, it's a fact based question. So this I'll share with you after the class. You can just go through that. 11.43 plus or minus 3.63 multiplied by score, multiplied by total score. This is the final formula of Gustafson method by using anterior teeth. So this is one of the very important question. Very, very important question. Gustafson method. Yes, Maranya, Ruday, Priyanka. If you mention all these points, like what is Gustafson method and what are the components and one word explanation for each, then grading. Then if you mention all this mild, moderate and severe, that is grading, and finally the final formula. So how much probably your expectation in your upcoming university exam? Come on guys. Yes, single icon. Sure, 100%. You can attend my class. We are there to help you. Okay. I am big fan of my students. If you are my fan, that is really nice, so that we can interact, you can exchange so many things, we can become friends. So we can make class interactive and we will learn more and more forensic medicine. Okay, good. So that's it. That's great. Distinction, very good. 5, okay. For 5 marks, 4. Good. Oh, next I have, okay, the first topic was fingerprint. The second topic was that is lip print, and the third topic that was Gustafson method. Now fourth topic very commonly as cephalic index. Okay, so what is cephalic index and what are the different types of cephalic indices, very commonly asked. So cephalic index basically for race. Race. The point number 1. So there are many indices, like example brachial index, femoral index, humeral index and all. But the most important index we use is that is cephalic index. What is cephalic index? CI is equal to, okay, breadth of the skull divided by length of the skull multiplied by 100. Now you can notice here, this is applicable in living person also, even dead person also, even in skeletal remains also. So what is this? This is basically spreading calipers. Spreading calipers, and what you can see here, this is glabella and this is occipital protuberance. Can anyone tell me what is this parameter? What is this parameter? That is like this, like this. What is this parameter? Come on guys, is it breadth or length? Is it breadth or length? Come on. So it is max breadth divided by max length. Maneka Datta and others. Okay. So let me show you with this now. See, this is glabella. So from glabella to occipital protuberance, this is basically maximum length. And between the two parietal eminences, we call it as biparietal diameter. That is basically breadth. So it is breadth divided by length. A very important question. The one that is used is spreading calipers. Okay, good. That is basically length. So this is length. So depending upon this, the skulls are classified into 3 types. So one is dolichocephaly. Dolichocephaly, long-headed, we call it as long-headed. So around 70 to 75. Second one, mesocephaly. (76 to 80). Anything that is more than 75 to 80, that is basically mesety. Brachycephaly, that is more than 80. And some books gives hyperbrachycephaly, that is more than 85. So, but anything more than 80, that is basically brachycephaly. So, brachycephaly normally in Mongolians. Mesaticephaly, Europeans and Indians, Chinese. Dolichocephaly, usually in case of Africans. Blacks, basically Africans. Also, some books use pure Aryans. That is also correct. Okay? Yes. Now, my question is, what is the cephalic index of Rohit Sharma? Come on, guys. Rohit Sharma. Write in the chat box. Rohit Sharma. Write in the chat box. Chris Gale. Ben Stokes. So 3 questions for you. You just type the answer there. Rohit Sharma, one of the great player, my favorite. Chris Gale, RCB, Chris Gale. Then Ben Stokes, one of the finest all-rounder of England. Jaldi batao. All the 3. One by one. Yes, Menaka Datta, excellent answer. Rohit Sharma, 75 to 80, mesaticephaly. And Smaranya Hatti, Ben Stoke, Europeans. Again, Europeans basically, again, that is same. Then Gale. What about Gale? Chris Gale. Yes, Chris Gale, basically 70 to 75. So basically long-headed. So again, one important MCQ here. So long-headed means that is basically dolichocephaly. In dolichocephaly, anterior posterior diameter is maximum. AP diameter is maximum in dolichocephaly. Cephalic index is minimal in dolichocephaly. 2 important MCQs. Very commonly asked in INA CET exam. Ben Stokes, good. Many answer. That's great. So you can write like this in exam. This is taken from KS and Reddy. Cephalic index given by anatomist Ander Regius in 1842. Dolichocephaly, mesaticephaly and brachycephaly. You can see here same. So Aryans, Aborigines and Europeans, Chinese and Indians and Mongolians. So this is what given in standard textbook. You can just go through this after the class. Okay. So this is about the question number 4. The question number 5, usually a 3 marks question. So basically determination of sex. Barr body and Davidson body. See, Barr body, Davidson body. So they're basically because of inactive X chromosome. So as you know, in female, there are 2 X chromosomes. One become inactive, that is visible as Barr body. So what is Barr body? So this is Barr body. So Barr body is attached to the nucleus. So Davidson body or drumstick body, that is attached to the neutrophils. So this is neutrophil. So lobes of neutrophil, and this is the nucleus. So normally we use buccal smear. So buccal smear is commonly used for basically for Barr body estimation. Okay. So 3 marks question, very simple. So Barr body seen in somatic cells, Srinivas, very good. And Davidson body, that is seen in case of neutrophils. That's great. So Priyanka also answered. That's really nice. So it is simple question, 3 marks question. And in exam, you can mention Barr body found in somatic cells. So in case of males, basically XY. Females, it is XX. So one egg, so that is basically becomes Barr body. So commonly we take buccal smear. So this is Barr body. You can write the diagram. And on the other side, what we can see here, Davidson body. So found in neutrophils. usually in the peripheral smear. So for Davidson body, we take peripheral smear. For buccal smear, basically for the Farre body. Good. That's okay. That's fine. So this is about 5 important questions that can be asked from your identification. So 1 or 2 questions from the topic, that is forensic psychiatry. So one important question is McNaughten rule. Can anyone answer one word for McNaughten rule? McNaughten rule. One word, McNaughten rule. Yes, my dear students, how is the Josh? So how is the Josh in forensic class? I said in my Farre classes, in previous classes, Josh should be very high. You need to interact with me so that you can keep yourself awake and myself awake in the live lectures. Okay. Yes, Mainaka, Ruday, Chandana, Srinivas, and Sanjana Lokesh, and Smaranya Hati, Smaranya, Somirip Sarkar, Muhammad Ansari. How is the Josh, guys? Okay. Okay. So before that, so who was McNaughton? Okay. So McNaughton, he was basically a mentally ill person. Mentally ill person. So mental illness can be anything. Okay, schizophrenia, a bipolar disease, psychotic depression, anything. So he was suffering from delusion of persecution. So he was thinking that, he was having abnormal thought that the Prime Minister of England was behind him, was trying to kill him, something like that. So he was having a delusion of persecution. So under this, so what he did, he committed some crime. He killed the PA of Prime Minister. Okay. So he was suffering from mental illness, under the influence of mental illness. So what he did, he killed PA of the Prime Minister of England long back, around in 1840s, I think. So later they came to know that he was suffering from mental illness, and all this happened because of his mental illness, not because of the McNaughton's crime. So after that, the court acquitted him, and so that is known as criminal responsibility of insane. Criminal responsibility of insane. So insane person, he don't have any criminal responsibility. So that is nothing but McNaughton's rule. So this is implemented in India in 84 IPC. 84 IPC, that is Indian Penal Code. Now it is changed to 22 BNS. So all of you write in the chat box, McNaughton is equal to 84 IPC is equal to 22 BNS. आपको लिखना पड़ेगा. Aishwarya and others, keep writing. This is very, very important MCQ. Keep writing everything. McNaughton is equal to 84 Indian Penal Code, 24 Bharatiya Nyaya Samhita. Yes, keep writing. So in exam, whenever this question asked, you need to write like this. This is taken from again K.S. and Reddy. This is the line you need to write in the exam. Nothing is an offense. Nothing is an offense. Murder, attempt to murder, hurt, grievous hurt, any offense is nothing. Nothing is an offense. Okay? which is done by a person, done by male or female, any person. Person means human being, not the animal. Who at the time of doing it, this is word important, who at the time of doing it, by reason of unsoundness of mind, unsoundness of mind, at the time of doing murder, at the time of doing grievous hurt, attempt to murder, he was suffering from schizophrenia, then it is applicable. And incapable of knowing the nature of the act. So he don't have any understanding of crime. He don't have any guilty mind. He has only guilty act, but guilty mind is not there. Planning is not there. So there is no question of revenge here. No revenge, no avenge. So or that he is doing what either wrong or contrary to the law. This is important one. An important line you must know. I'll repeat again. In exam, nothing is an offense which is done by a person who at the time of doing it, by reason of unsoundness of mind, example, schizophrenia, bipolar disease, psychotic depression, delusion, incapable, this word is important, incapable means no understanding. So, like example, schizophrenia is set. Okay, now let's see here some examples. Now look at this. This is a very interesting scenario. All of you guys try to understand. So he is basically Ravi. He's Ravi, okay? Ravi, you know, Ravi Chandran, Ravi. Ravi, a 35-year-old man, is 35-year-old man, has been diagnosed with severe schizophrenia. He's having severe schizophrenia, he's having delusion of persecution, third-person hallucination, disorganized speech, disorganized behavior, negative symptoms, positive symptoms, everything is there. So one day, while experiencing psychotic episode, he believes that his neighbor house is on fire. And he must break in to save them. So abnormal thought process. Okay? In reality, there is no fire. Ravi ends up causing significant property damage. So is it punishable or not punishable? So my question is Ravi is punishable, criminally liable or not liable? Yes, come on guys. So all of you can try to answer. Not liable. Good. Not liable. One more scenario. Look at this now. It's a very interesting scenario. If under the influence of insane delusion, the person thinks another man. See, the person thinks another man, like me, Dr. Manjunatha, FMT Guru, as another man, to be a wild animal. So his thought process is basically, he thinks that I am not a human being, I am like a tiger. So, and he kills him. And he kills him under the influence of mental illness. My question is, will he be held criminally responsible or not? Again, all of you guys. Smaranya and others. Again, answer is not liable. Not liable. Not liable. Now, one more question. Now look at this. If under an insane delusion, a person thinks that another person had caused serious injury to his character, or family, or property, and he kills him. So during investigation, they came to know that he is suffering from psychotic depression. And he killed all these people, and there is a motive is there. The motive is revenge. The motive is revenge or avenge. So my question is, will he held responsible for this or not? Now try to answer. Liable, not liable. So there is a motive. He is clearly stating that he killed because of some revenge. The past history and the revenge is there. Yes, now he is liable. Very good. So now liable. So why? Because in McNaughten, no revenge. So this word, remember, in McNaughton's rule, everything has been mentioned at the time of doing the crime, but revenge word, revenge is not included. When word revenge is there, avenge is there, then it is definitely murder. It is not McNaughton's rule. It is basically murder. Liable. So this is how you can explain McNaughton's rule in your exam. Okay. So this question, can you try? Smaranya, what is your doubt? No. Culpable homicide doesn't come under McNaughton's rule. It is the totally different scenario. It's unsound mind. So unsound mind is different, and culpable homicide is different. Okay. Yes. Now look at this. Try to answer. In 1843, Edward Drummond, all this. Not liable, right? Not punishable. Okay. So next, some important questions, all of you guys. So after the class, you can just go through this important topic. Types of delusion. So delusion is a disorder of thought. There are many types of delusion. Delusion is a feature of psychosis. So there are 8-9 types of delusion. You must know. Very important question. Types of hallucination. Hallucination is a disorder of perception. So auditory hallucination, visual hallucination, and all 3 marks question. 3 marks. Impulse disorders, kleptomania and all. 3 marks. Then very important 5 marks question. Civil criminal responsibilities of an insane person. 5 mark. So basically you can mention about McNaughton's rule. What are principles of McNaughton's rule? You can mention about 22 BNS, or you can mention about 84 IPC. DNA fingerprinting, the steps. Isolation, Southern blotting, RFLP and all. 5 marks question. So you can just go through this after the class. Then identification data, 5 marks question. So there are 15 identification data given in standard textbook that you can write in exam. 5 marks. Tattoo can be 3 marks. So what is the medico-legal importance of tattoo? So very commonly asked. So tattoo can help you to identify the person. So male or female, sometime, or religion, or sometime the personality as well. Scar mark importance, 3 marks question. Superimposition, 3 marks question. Cephalic index, 3 marks question. And very, very important, true insanity and feigned insanity. Very commonly asked 5 marks question. Psychosis, neurosis, 3 marks. Corpus delicti, 3 mark. So all these are most expected questions that can be asked in your upcoming university exam. Must know topics. Must know topics. Yes, guys. So 20 important questions. Now let's start some MBBS questions. So some photographs, some important Viva questions, some important theory concepts, some important MCQ concepts we are going to discuss in next 20 minutes, around 20-25 minutes. Yes, guys, shall we start? Shall we start, guys? Yes, Priyanka. So, Smaranya, we are going to discuss some X-rays, especially wrist joint today, and some other day we'll discuss other joints as well. Okay, so be attentive. Smaranya, are you there? Smaranya? Soumidip Sarkar? Ruday? Okay. So the first forensic important concept is today's. Now here there is a delusion. Okay, there is a delusion, and you just listen to this question. Later you can type the answers. So say example, me suffering from some mental illness. So me, say example, me like a McNaughten suffering from some mental illness. So what mental illness basically the person is having here? He thinks that people are reading my mind. I think that Donald Trump, American president, is reading my mind. So my delusion basically. Then, and also I do think that CIA and other investigating agency are behind me, and everybody is copying my work, and everybody is copying my communication through radio waves, and helicopters are there above my house. I am staying in Bangalore, so helicopters are moving actually. So all these helicopters are trying to capture me. They're trying to kill me, something like that. My question is, what type of delusion is this? The point number one. Point number two, can I name one condition in which it is commonly seen? The point number three, criminal responsibility. Criminal responsibility. So now three questions for you. You just try to answer one by one. So this type of delusion, so known as delusion of persecution. It is commonly seen in split personality, that is schizophrenia. My question is, criminally liable, not liable? Not liable. Not liable under section BNS 2284 IPC. 84 IPC. Okay. So good. So many answered correctly. The first answer is Ansari, and the first complete answer given by Srinivas. So Srinivas and Priyanka as well. Yes, Priyanka and Srinivas. And here, so one more very important question commonly asked in exam: what are rules of insanity? So rules of insanity. So there are some 4 or 5 rules are there. The first one is the McNaughten's rule. McNaughten rule. The second one is Curran's rule. Durham American Law Institute test, ALI, American Law Institute test, irresistible impulse test, IIT, IIT, irresistible impulse test, IIT. So you can write like that, IIT. There are 5 rules are there. Rules of insanity. Insanity means insane person, not the sane person, means he is suffering from mental illness. There are 5 rules. 5 rules. Okay. So all of you mention all the 5 rules in chat box. It's mandatory. Write in the chat box so that 1 time writing is equal to 10 time reading. So keep writing. There are 5 rules are there. McNaughten, Karen, Darams, and ALI and IIT. American Law Institute test and irresistible impulse test. That is basically Lorena Bobbitt. So Lorena Bobbitt a story basically related to this IIT. Keep writing this. Okay. So this is first question, very commonly asked in the exam. So that's okay. Second question is very important question. So bit difficult question. So what you can see here, wrist X-ray here, wrist X-ray, and here you can see here a boyfriend and girlfriend. So all of you listen. Later you can try to answer. So the boyfriend and girlfriend. So both are studying in some so first year degree or second year degree or second PU like that. So they were studying chemistry. So chemistry together. The chemistry became physics. Physics became biology. So both are in deep love. But girl age is not exactly more than 18. It is less than 18. So we don't know that. We don't know. So later, the father of the girl, so he came to know about the relationship. He filed a complaint in nearby police station. So my question is now, is it rape or not a rape? And because when age is more than 18 years, it is not definitely rape. So because age more than 18, we call it as major. So any section of POCSO applicable when victim age less than 18 years. Now here the question is, what is the age? Is it more than 18 years or less than 18 years? And wrist X-ray is given to you. Wrist X-ray is given to you. So my question is it crime story or is it love story? More than 18, love story. Less than 18, it can become crime story because we call it as statutory rape. Try. Now here, what is the age? Now you calculate the age now. Go through this. What is the probable age? I need perfect answer. So like 12 years, 14 years, 15 years, or 18 years, more than 18 years like that. Okay, try to answer. X-ray is given to you. Okay. Okay, very good, Srinivas. Srinivas is telling, sir, 15 to 16 years. And it is a crime story. So now look at this. So look at this now, guys. This is one important finding here. This is one important finding here. So what we can see here, physiform is appeared. Okay, physiform is there. The physiform usually 11 to 12 years. 11 to 12 years. And radius and ulna not fused. So radius is not fused, ulna is not fused. You can see the clear gap there. So this is radius and this is ulna. So radius ulna appeared but not fused. So that means radius and ulna not fused. Not fused. That means less than 18 year. Less than 18 year. You can see here fusiform appear, radius ulna appear but not fused less than 18 year. Now also look at the lower end of first metacarpal. Look at this. This is lower end of first metacarpal. So is it fused, unfused? Look at this. First metacarpal. You can see the clear line there. So when you see clear line, dark line, that means unfused. So I'll write here first metacarpal, unfused. Unfused. Okay. You can see here it is unfused. When it fuses, let's see from the standard textbook. Let's see now here. Look at this. It is very important diagram taken from K.S. and Reddy. So I said about first metacarpal. First metacarpal. You can see here first metacarpal. 15 to 17 years. So this line. First metacarpal. First metacarpal is appeared but not fused. Now what is the age now? So what is the age? Now try to identify what is the age. Okay. It should be what? What is the age now? Okay. You don't worry, I'll help you. Swastik Sarkar, you don't worry, I'll help you in that. So here the age is, basically age is more than 12 years and less than 17 year. Less than 17 year. This is the answer I wanted. More than 12 years, less than 17 year. So probably of age 16 year or 17 year, less than 17 basically. So my question now, is it crime story or love story? Let's have discussion later. So time being, all of you try to answer. Is it love story or crime story? Okay, now let's have discussion about carpal bones. So carpal bones, you don't worry, I'll help you. Okay, good. Good. So next heading, wrist X-ray. How to interpret. How to interpret. So there are 8 carpal bones are there. There are 8 carpal bones are there. Right. Capitate. Hamate. Triquetral. Lunate. Scaphoid. Trapezium. Trapezoid. Physiform. So let me start with the carpal bones. Okay. Yeah, it is less than 17 year. Yeah, you are right, Smaranya, you are right. It's less than 17 year. So you need to minimize the range as much as possible. I said less than 18. Now I came to know it is less than 17 as well. So let's see now one by one for better understanding. Remember capitate that appears at 2 months. Hamate appears at 2 months. So this is important concept, try to understand. So capitate is the largest carpal bone. It is the first to appear, appears at 2 months. 2 months of age. So when a child is of 2 months, it appears, capitate hamate appears. Okay. Triquetral, we can remember very easily. Tri means 3 years. 3 years. Lunate. The shape of the lunate is moon shaped. So moon is there now. M-O-O-N. 4 years. So all of you write in the chat box. Lunate is equal to moon. 4 alphabets are there. 4 years. When it appears, 4 years. Keep writing. Keep writing, guys. Then comes his scaphoid, which is boat shaped. Scaphoid S is there. S for 5 years. S for S, that is 5 years. Trapezium, trapezoid, usually 6 years. 6 years. 6 years. Physiform, you can see here, 11 to 12 years. Again, it differs from one book to other book, but this is what given in case and ready. Okay. So what we can see here, hamate 2 months, physiform 11 to 12 years, triqueter eyesight 3 years, lunate 4 years, scaphoid 5 years, capitate 2 months, trapezoid 5 years, it's given 5 years. Some books give 6 years also, 5 to 6 years, okay. Then trapezium 6 years. So this is okay. So understood now? This is okay. Now let's see about the radius and ulna. Radius and ulna. So radius appears at 2 years. So lower end of radius appears at 2 years. Lower end of ulna appears at 4 years. The fusion normally occurs at 18 years here 19 years. And 18 and 19. This is important one. Then also you should look for first metacarpal. First metacarpal. You can see the first metacarpal here. The first metacarpal. So the fusion occurs at 15 to 17 years. 15 to 17 years. It fuses at 15 to 17 years. So this is very important concept, 15 to 17 years. Okay, I'll repeat again. There are 8 centers in the wrist X-ray carpal bones. They never fuse. Radius and ulna, radius fuse at 18 years, ulna usually 19 years. First metacarpal usually 15 to 17 years. Now let's see now this image. Look at this image. Now try to answer. Try to answer. Look at this now. Look at this. Look at this. Look at this and look at this. Try to answer. So here physiform is there. Physiform is there. So once physiform is there, then means all the carpal bones are there, right? Then radius is appeared, not fused. Ulna, not fused. First metacarpal, not fused. Now you calculate the age. Now calculate the age. So physiform appeared, that means more than 11 years. Radius not fused, less than 18 years. Ulna not fused, less than 19 years. First metacarpal appeared, not fused, that is basically less than 17 years. So what is the best answer now? Smaranya, Priyanka, what is the best answer? So it's more than 11 years and less than 17 years, right? So more than 11, less than 17. Or we can say more, less than 19 also correct, less than 17, 18 also correct. That's okay, less than 17. Okay, so this is okay. Now look at this and try to answer. Now look at this. Try to answer now. This one, try to answer. So this is question number 4. So this is scaphoid. You can see the board shape. Scaphoid. And what you can see here is a lunate. This is capitate. So all the carpal bones appeared. Radius ulna is also appeared and fused. The lower end of metacarpal, that is also appeared and fused. Now what is the age probably? So the answer is more than 18 years. Now more than 18 years, my question, is it love story or crime story? So love story means no problem, they can enjoy their life. Crime story means POXO and also statutory rape. Statutory rape. 63 BNS. Section 4 of POXO Act. So what is the answer, guys? Srinivas and others. Yeah. Question number 5. This one, 3. This is question number 4. This is okay. Fine. Smaranya, this is okay. Yeah. Radius ulna fused, no? There is no gap here. So there is no gap. Right? Okay. Now next image based question from toxicology. Look at this and try to answer. What is this? Identify. And what are clinical features? What is the treatment? What is medico-legal importance? So 4 questions. There are 4 questions. You need to tell me the answers. Try to answer. So whenever you see spiny projections, all of you try to understand spiny projections. You can see the spiny projections. So this is basically Datura. Datura, known as thorn apple. Thorn apple. Clinical features, 90 manifestations. Like example, dysarthria, dysphagia, delirium and all. 90 manifestation. Death also, 10D manifestation. Why? Because of hyoscine, hyoscyamine and traces of atropine. Because of the atropine toxic. Treatment is physostigmine. Physostigmine. Why? Because Datura consists of hyoscine, hyoscyamine and traces of atropine. So atropine antagonist is basically physostigmine. Physostigmine most common complication is cardiovascular complications. The fatal dosage 100 seeds. The fatal period 24 hours. Then medico-legal importance. It's a road poison, a railway poison. It is used in case of kidnapping, a robbery, sometimes sexual assault, especially kidnapping of children, it is used. So rarely homicidal, rarely suicidal and all. Usually it is all is our medico-legal importance. Okay. Yes, so good. I think okay, swastik sarkar. Yeah, that is fused. Good. So accidental as well. Okay, good. So I think first to answer Muhammad Ansari and Srinivas, and also by Menaka Datta. So all the three answered as usual. So good answer. So this is Datura, very important 3 marks question. Then the 6th question. So now my question is, so this is a very famous movie. Movie name is Onion, and as you know, it is multiple personality disorder. So my question is, what are dissociative disorders? Can you mention 3 dissociative conditions? Come on, guys. So, have you seen this movie? Ramanujam is one personality, and Onion is the second personality, and Ramo, R-E-M-O, Ramo. So that is third personality. We call it as multiple personality disorder. So my question is, what are the conditions of dissociative disorders? Dissociative disorders. Muskan Maharaj, others. What is this condition? So identify this condition. So very simple question. Is it bipolar? Yes, very good, Srinivas. Srinivas answered correctly. So this is dissociative identity disorder. Also known as multiple personality disorder. So there are 3 conditions you must mention in exam. So there are 3 conditions. One is dissociative identity disorder, depersonalization disorder, and third one, dissociative fugue disorder. Fugue. And also go through the description given in standard textbook. So one or two, more than 2 personalities, basically that is known as identity. When there is a feeling of detachment from oneself, that is known as derealization disorder. Fugue means basically abrupt change in the geographic location with inability to recall past and loss of identity. Like example, me staying in Bangalore, suddenly, I'll go to some place like Delhi and I'm unaware of that, and I'll start some new life there. So new car, new family, something like that. So that is known as dissociative fugue disorder. And remember, this is not intentional. This is abrupt in geographic location with inability to recall past and loss of the identity. Okay. Yes. Good. And one more question from forensic psychiatry. Look at this and try to answer. A beautiful girl, 21-year-old woman, reported missing by her parents in New York. Years later, it is discovered that she is living in Florida. She has no recollection of her previous life in New York. So New York and Florida. So 2 identities, 2 different places, and there is no recollection of the past. What is this? Dissociative fugue, dissociative identity, or other type? 7th one. 7th, try to answer. So this is basically known as fugue. Good. So the first to answer by Smaranya. Yes, Smaranya, good. Smaranya answered correctly. And Srinivas also. Srinivas. Now I have one more question from the same topic. Look at this question and try to answer. A 29-year-old woman present stating that several times last month she felt that she was outside her body. Outside her body. It's like example me. I'm not there inside. I'm there outside my body. So outside my body. And describe experiences but says feeling of like watching a movie of herself. Like me watching my movie from outside. Okay. So what is this known as? Yes, come on. It's fugue or what is that? Mohammad Ansari, Mohammad Tallar, Sanjana Lokesh, Priyanka. Watching movie of herself. Like me seeing my movie from outside. Okay. So Ansari, is it interesting? Maranya, Srinivas. So this is 8th question. I think many answered. The first to answer by eighth question. Ha, Mohammad Ansari. So Ansari, very good. So this is depersonalization. Depersonalization. Okay. So I hope you understood all the scenarios. Now is it clear, guys? Is it clear? Is it clear? Any doubt in these three? Mohammad Ansari? Srinivas? So watching movie of herself from outside, that is depersonalization. Multiple personality, dissociative identity disorder. Abrupt change in the geographical location with inability to recollect the past things, the past identity, that is dissociative fugue. All these are very confusing. I hope now it is clear. So again, this is very important in forensic psychiatry. Why? Because it is related to McNaughton's rule, criminal responsibility of insane. Srinivas, Mohammed, Maranya. Then the last question, last but one question. So there are some new questions. You know, we discussed so many spotters in forensic classes, previous classes. That's why some new topics and new concepts to explain. A 20-year-old female presents to therapy after breakup with a boyfriend. Again, boyfriend and girlfriend. So the quarrels are very common. She always did everything he wanted, but cannot understand how he would not want to be with her. So according to her boyfriend, she was too clingy and asked him to make every decision for her. So my question is, what type of personality disorder is this? What is this personality known as? Simple question. So you can just go through type of personality disorder. But here, girlfriend, you know, she is totally dependent on boyfriend. So even for minor decision, major decision, okay. Minor decision, she is dependent on the boyfriend. And because of this, so there is a quarrel between both husband and wife or the girlfriend and boyfriend. ये क्या हो सकता है? What is this personality? So look at this. So there are different types of personality. So this is taken from standard textbook, cluster A, cluster B, and cluster C. So paranoid, schizoid, schizotypal, antisocial, borderline, histrionic, narcissistic, avoidant, dependent, obsessive compulsive disorder. What is the best answer for this? Best answer. So this is very important in forensic medicine. Borderline personality disorder. Very, very important. All of you try to understand. So the answer for that question is dependent. The answer is dependent. In borderline personality disorder, there will be suicidal tendencies. Suicidal tendencies. Very important. And in forensic, we do teach hesitation cuts. They are very common. hesitation cuts. So there are basically multiple cuts around the main cut or scars of hesitation cuts that shows that she or he suffering from borderline personality disorder. They need treatment. Okay. Yes. Good. Dependent personality. That's great. So I think first to answer, I think by Srinivas also, and the nursing. Nursing, I think some name is there. Okay. Sanjana, very good. Sanjana. So all of you write in the chat box. BPD is equal to. BPD means borderline personality disorder is equal to hesitation cuts. Hesitation cuts. Very important. Keep writing. So last few minutes. Keep writing, guys. Keep writing. Okay, good. And the last question. And the last question. So very important question in forensic psychiatry. So now go through this and try to answer. I'll give you around 1 minute time. So what is the diagnosis? And why? And why? So here, 47-year-old man, so brought to emergency department. Okay, so because of abnormal behavior. So abnormal behavior over past 8 months. 8 months, so more than 6 months. He has claimed to hear voices. So he is hearing voices from his dead grandfather or grandmother, and he is talking to them. So and there can be second person hallucination, third person hallucination. So basically there is a hallucination. So 40-year-old, 40-year with a history since 6 months, and there are delusions. So there are delusions and hallucinations. Hallucinations. So third person hallucination. So they are talking, or he is talking, she is talking. He is the chosen savior of the world. Okay. He used to work as a janitor in a local elementary school. So he is having abnormal behavior, disorganized behavior. Disorganized behavior. And also is having disorganized speech. So disorganized speech. Okay. So what is this basically known as? What is this basically known as? So disorganized behavior, disorganized speech, hearing voices, third person hallucination, delusion of persecution since last 6 months. So your answer must be schizophrenia. Schizophrenia. Good. So you can just go through this. So this is what given in DSM-5. So there are 5 criteria. delusion, hallucination, disorganized speech, disorganized behavior, and negative symptoms. Rest all you can just go through your psychiatry. So time being, this is more than sufficient for your upcoming forensic exam. So schizophrenia, one classical example of true insanity. Okay? True insanity. So all of you write, true insanity is equal to schizophrenia. So time being, you can just write in the chat box, truly insane person. That means schizophrenia, that is basically split personality. Not the multiple personality, split personality. Good. First to answer for this question, Muhammad Ansari, very good, schizophrenia. Srinivas, good. Smaranya Hatti, great. So, but try to memorize these 5 important criteria: delusion, hallucination, disorganized speech, disorganized behavior, and negative symptoms, along with impaired functioning. So probably is having difficulty in working environment, interpersonal relationship, and self-care. Self-care is also not there. So this is probably a case of true insanity, that is schizophrenia. Good. Great answer. So this is about the schizophrenia and psychiatry. Now I have one more plant today. So all of you guys look at this plant and try to identify. So this is commonly kept as a spotter in forensic medicine. So what we can see here, this plant. So this plant has spiny projections. It has spiny projections. And this plant, basically the capsules are in clusters. You can see in clusters like this, clusters. Identify this plant. What is this plant? So it is somewhat irritant. It is having irritant smell, and they will prepare some oil from this. The oil is not poisonous. So only the seeds are very poisonous, and the seeds, especially the serum of the seeds, when it enters the body, it causes hemorrhages and death. So what is this basically? And this is used in umbrella murder case. A very famous journalist. So Marco, I think Marco, he was killed by some agency by using umbrella tip with the pellet inside. So the pellet was containing ricin. It's a agent of bioterrorism. Okay, it mimics like a natural disease because it causes brain hemorrhages, liver hemorrhages, and kidney hemorrhages and death. So what is this plant which occurs in clusters? It looks like Datura. So remember, Datura occurs singly. This basically occurs in clusters. The fatal dosage 10 seeds. What is the best answer? So Muskan Mehraj, Muhammad Ansari, very good. So this is castor plant. Okay, castor plant. The fatal dosage is 10 seeds, and it inhibits RNA synthesis, protein synthesis by inhibiting RNA polymerase. So fatal dosage around 10 seeds. I said fatal period is around 24 hours, maybe 3 to 4 days. Clinical feature: it causes nausea, vomiting, diarrhea, and hemorrhages in the brain and death. So and remember, there is no test to identify ricin because it's organic irritant. It dissolves in the blood, so there are no particular tests for that. It is also a category B agent of bioterrorism. Again, this is MCQ asked. There are many categories: category A, category B, and category C. So category B basically, that is ricin. So umbrella murder case, it's a famous case of Ricinus communis. The common name is Arandi plant, also known as castor plant. The seeds are very shiny. There will be black and brown markings also. Okay, so this is about the this is about the some good castor plant. Okay, now I have one more question. So basically a question very commonly asked in exam. I think already we discussed many times. Now look at this basically. You try to answer. Yes. So features of so again very commonly asked in the exam. So what are the features of female pelvis? One by one you try to identify. So now look at this. So this is basically female pubic bone. We call it as, that is, iliac bone, pubic bone, right? Hip bone, basically it's hip bone. So now let me know what are the important features of this female hip bone, one by one. You need to answer. Now look at this. What is this basically? What is this? You just concentrate on the video, you will come to know. So this is point number one. So what you can see here, this is the sciatic notch. So can anyone identify? Yes, one point, the first point, sciatic notch, very important point. Sciatic notch. So sciatic notch is shallow and broad. So this is very, very important in forensic medicine. So let me do comparison with the male hip bone. I think now you can make out in this. Now you can make out the sciatic notch, greater sciatic notch. Can you make out, guys? Can you make out the angle? So male. So this is left side, that is male, and the right side, that is female. So we can make out this sciatic notch. Sciatic notch in male, it is basically, that is shallow and broad in female, deeper and narrow in male. You can make out. So this is, you can see here. So in female it looks like this. It looks like this, female. So in male, somewhat like this. This I think you can make out here. You can make out. Can you make out the first difference, guys? The first difference? Yes. The second difference, let's come back to the female pelvic bone. So one very important finding, the preauricular sulcus. So I hope this is visible. So this is preauricular sulcus. You can see a groove there. So groove, which is known as preauricular sulcus. The second point, preauricular sulcus in female, it is prominent. Prominent. So very important. Now you also compare obturator foramina. So very important. Obturator foramina. Now look at the obturator foramina. You just let me know what is the shape. What is the shape in both? Try to identify. This is male and this is female. So can anyone identify what is the shape there? So this is also a very important question. So in case of female, it is basically triangular. Triangular in female. So round in case of male. So round in case of male. So there are many differences like this. There are more than 10-15 differences are there. You can just go through. Then ischial tuberosity, one more difference, ischial tuberosity. Ischial tuberosity, that is averted in female, averted. So you can make out here, this is ischial tuberosity. Ischial tuberosity, you can see here, it is averted. So in case of female and inverted in case of male. So there are basically many differences. Okay, great. Now let's have discussion about skull as well. Skull. So features of male skull. So 1, 2, 3, 4 and 5. 5 major differences. 5 major differences. So now you can make out here. You try to identify, this is male skull. This is male skull. It's a real skull, all of you. The real skull for the academic purposes. Now look at this male skull, steeper forehead. You can make out steeper forehead. Can you make out any other features other than this steeper forehead? Acha, very good. So many answered. Sir, sloping forehead, orbits are square. Very good. So orbits are square. That's fine. Prominent glabella, frontonasal junction. That's great. Any other feature? Yeah. So one by one, in male skull, steeper forehead. Second, glabella is prominent. So glabella is prominent. P for prominent. Okay. Then orbits. Orbits are square. Orbits are square. So all the muscle markings, bony markings are prominent in case of male skull. The male skull is heavy, so more voluminous than the female skull. So, and one more important, remember, supraorbital margin, or we can say orbital margin. Orbital margin. Are blunt. So orbital margin, if you see the orbital margins are blunt in case of male skull. In female, they are very sharp. It's like a blade. Okay, it's very sharp. So that is one very important feature. How do I remember female brain is sharper than male brain? So orbital margins are sharp in females. Okay. Then one more important is frontal and parietal eminences. Frontal, parietal eminences. So they are small. So this is very, very important one. Very important. Very important. Okay. Yes. Good. You can see here frontal eminences, parietal eminences are very small in case of male. Rest all are very prominent. Okay. Okay. So palate is ovoid, that's okay. So any other feature? Any other feature here? So rest all I think you can make out. So this completes your session. So 5 minutes. If you have any doubt, you can ask me. So doubts, if you have any doubts, you can ask me. So yes, Maranya. So if you have any doubt in today's session, you can ask me. So we discussed so many things today. Now, okay. So Maneka Datta, Priyanka, Srinivas, and Ruday, great. Master processor prominent. Okay, that's all great. That's great. Thank you. Okay, Mohammad Ansari, that's great. Maranya, are you there? How to detect Ricin for confirmation? So basically, there are tests. So to identify Ricin itself. So, but it's an organic irritant. If there is a doubt, so we need special reagent. So not the usual reagent, we need special reagent. So by using that, you can identify, and also by looking at the crime scene samples. So in forensic science laboratory, they can detect the Ricin sample as well. But in general, in the blood, it is very difficult to identify Ricin because it's an organic irritant. It mixes with the body substances. That's why. Yes, Maranya, proof of identity in comparison. See, so proof of identity. This is basically nowadays it is not applicable. Now we have computer applications. So olden days, so they used to compare with the magnifying lens. Okay, so the fingerprint with the magnifying lens. So in that case, they used to compare 12 points. So nowadays we know it's all computer based, it's all application based, so they can detect very easily within seconds. But olden days, they used to compare the matching points. So the ridges, the size, the direction, loop, or dissected, grooves and all. So that is in olden days. So that are basically features of fingerprint. Acha, okay. Ha. Okay. Smaranya, look at this. What you can see here, this is epiphysis. Okay. So this is epiphysis. This is diaphysis. So what you can see here, between epiphysis and diaphysis, can you see the gap there? When you see the gap, then it is unfused. When there is no gap, then it is fused. Okay, so that is the meaning of that. Okay, good. Good question, Mohammed. So, yeah, it's Aadhaar card. Definitely, they use fingerprint. They'll take iris print as well. So that I'll let you know some other day. I'll just go through the because it's very rare disorder. So that's why. Yeah. Okay. Now I think Smaranya, can you make out here? This can you make out here? There is no gap here. If you want, I'll just enlarge this. Okay. Now you can make out here. Can you make out? There's no gap here. It's look a single line, single bone here. Can you make out? Acha, fusion of first and okay. That is also a good question. Look at this now. This part, what you can see here, this fused. So this is first metacarpal. So what we can see a first metacarpal. It is totally fused here. There is no line here. When you see the line, that is unfused. Okay, when you see the dark color line, so that means unfused. That means there is a cartilage, there is no calcium. Yeah, there is no gap, that means it is fused. It's fused. You are right, there is no gap means it is fused. That's what I said in the class. Okay, any other doubt? Any other doubt, guys? So second doubt, that is actually about the fused or unfused. So fused means no gap. Unfused means there is a gap. Simple. Yes, Priyanka. Priyanka and others. Any other doubt? Okay. So in next class, we will discuss about elbow as well. So one by one. So elbow one day and shoulder joint one day. Yes. Mine, Naina Datta is answering. Okay, superimposition. See, this is very simple. Superimposition means the comparing skull. For example, this is a skull, real skull. For example, this is found in the crime scene. So, the comparing skull along with the video, the previous video, previous Instagram video, WhatsApp video, photograph, that is known as superimposition. The comparing skull that is found in the crime scene with the video or the photograph of the person, suspected person who is missing, that is superimposition. So there are now by using AI, by using other applications, you can determine whether this skull belongs to a particular person or not. Okay. Okay, dental chart. Okay, next class we will have discussion about dental chart. What is universal? What is a Hader system and all? We'll discuss FDI, modified FDI and all. It's a good question. Yes, Priyanka, I have understood. Naina Datta, Muhammad Ansari, Smaranya Hatti. Yeah, computerized. What is identification data? This is very, very simple. So this I'll explain with this. See, identification data means, for example, this is skeleton. So what are the characteristics of skeletal remains? Like age of the skeletal remains, gender, male or female, height or stature, or it can be a fingerprint, so it can be tattoo, it can be scar. So whatever data which are very helpful in identification of person, they are known as identification data. So they are very important in criminal cases as well as civil cases. Like example, murder. So in murder, very important is the corpus delicti, that is a dead body. So dead body is very important. So identification of dead body with the help of data is known as criteria of identification. Okay, Priyanka, Ruday. So Mohammad Ansari, thank you for the feedback. Thank you, Ansari. You are also great because you are attending forensic class with a lot of enthusiasm. So it's really great to see you all. So Chalo guys, bye bye, see you. Say bye to our friend, your friend. Okay. Hi, bye bye. See you in next Farre class. Bye bye guys. Okay, you just select name. So we will keep Brownie and Twinkies over. So I think good name. You can find Garuda is a good name, I think. So say bye to our Garuda. Okay, his name is Garuda. So he's, you know, he's taller than me, around 6 feet or 6, 7 feet. So he must be Garuda, very strong man. Okay.